Hey everybody, how's it going today? It's Frankie here and the back with a video on this channel. I'm coming with new ideas as I go by for this new and recent channel that I made like months ago. And today I'm gonna be talking about going to the doctors, the most annoying things about doctors, and probably good things too. Probably just tied to it going to doctors anyway. I know you just hate it when you go to doctors and you know the doctors always tell you to just breathe in, breathe out, or you just go to a doctor and you sit in the reception and they take long or whatever it is. Yeah, I'm gonna be talking about things like that. Now, I've been to doctors, I mean, as everybody else has. It's just so annoying when you get into at the doctors. Depends what doctors you're in, by the way. If it could be like a big doctors with a big reception, or like a small reception area, and you just go in and it's packed and you just can't find a place to sit. I mean, going to doctors when you were a kid, you used to have your grandparent or parent take your uncle, whatever it is, that would take you to doctors before, and you just can't seem to find a seat. I'm pretty sure that's happened to me before. Or when you walk into doctors and, excuse me, and you sit down, and you always hear that one person coughing, like that basically. And that's annoying to hear, especially when you're sick, as when you just feel drained and you're just waiting for the person to call your name at the receptionist just to call your name. It can be depressing. You're just sitting there and just like, oh, please just call my name out for love of God, please. No matter what age you're at, it always gets annoying. And obviously, some people change doctors over time when they were a kid and they got new doctors now. That's just usually how it is. Or you're just hearing somebody just argue with the reception about something, saying, my appointment was this date, but I was told to come in today. I'm not really happy with this. Not at all. Or especially the queue. There used to be a doctors I used to go to when I was a kid before I, before I booked my local GP here, before I even went to this one, the local one. I used to go to another one. And oh my God, man, it's just so, like the queue, there could be a queue. Bear that in mind. Whereas that from the until like the end the door type of thing, like the entrance. You just wait a while. You think it's just them booking an appointment. How long can it be? When they talk about describe it, and then doctors I used to go to, there's always like it just felt like kind of cramped. It was just like women there, just like having like different like was it medical records or whatever it is of like folders or whatever it was behind them. It must have been cramped working there. And then I remember going to that old GP. Yeah, my family know what I'm talking about. Family members that have been their doctors before, they know what I'm talking about. It always used to be fun because usually it always used to be early morning. I know when I was a kid, I used to be taken to doctors early morning, or like between 9 and 10, for example. And you just see them have a. I just seen them have a TV there, and that was the most interesting. Just watching the TV, and I think it was like this morning they were showing crazy times. Now that's a tiny TV, and I think that's just to make people watching get distracted as the time goes by. It did kind of work, but then it was a boring show on there. But at least I had something occupied. I think I remember they changed the channels as well. That was a good thing back in the day. That was that was lit, you could say, with the TV and watching it. What else? And when they call out your name, but yeah, you always have to figure out who is before you because there could be loads of people there. It all depends on who's before you, basically. And yeah, it was difficult to tell. Sometimes it could be somebody that came in after you, and then it gets called, and there's like a whole load of like issues going on, and so it's commotion and palaver. I never used that word palaver before. Well, I have, but not on a video, I don't think. And yeah, and hearing those babies cry in the pram, that's rare, but it happens, and that can be quite annoying to hear. And you're just looking around thinking, "Oh God, this is a bit awkward, bit awkward." It can be, and you always get that one person talking to you as well. It could be a person that you recognize. That could be quite funny too, actually. When your name does get called, it could be for like anything basically. And you go into like a doctor's room, you go see your main doctor, and if the doctor's not, you see another doctor. Now, sometimes doctors, for me, this is the annoying part, is when you tell them what's wrong with you, they can't seem to find a normal solution. I get they don't know what's wrong with our bodies, right? They don't have no idea what's going on in there. They don't know how our bodies would work because everybody's body works differently in some ways. And you just tell them, but I got a little pain here, I got a pain there. They start checking you for something else. Like, just sort out the pain there. It could be serious, it could be life threatening. If it's mine, I can understand. And then they say, oh, we'll take you, we could do some tests here, just come on this day. If there's a lump, if there's some sort of pain, that really severe pain, excuse me, if there's some severe pain, then why on earth are you not getting it tested on the day? Sure, there should be tests right straight away on the day. That's annoying. And I get why they do, because I have other patients to look up, blah, blah, but they could take you to another room and do tests if it's that serious. If the person thinks it's serious, especially with their body, they should just be able to straight away just get them checked. If it's something minor, like a cough or whatever, or some sort of bit of swearing here and there, maybe swearing could be serious. Or maybe just a bit of a bit of cramp, fair enough. But if it's something really major, get it checked immediately. And they just prolong it. And then, especially when they say, oh, well, we found nothing, even though you know there's something, but they still can't find it. And I know it's good to, like, there's no, if they find nothing wrong with blah, blah. But then at the same time, you want to prevent that issue. So that's one thing I think the doctors should be doing a bit differently there. And this is another part right here. Oh, this is the killer part. This part here. Oh man, this is the thing I just can't stand sometimes. Is when they have when they give you that take that draw blood basically. Now for me, I don't have a phobia of needles. Right? When they draw your blood, it's always those tiny needles that are this big. That's not scary. That is not the scary part. I don't have a phobia of them. It's going in your skin that's the worst part. And then I remember going to doctors once, which is my local doctors, and then this woman saying, "Oh, just look away. If you keep looking, it'll be fear, and that'll make it worse." Well, it's going to make it worse either way, isn't it? If somebody kicks you, what are you going to say to a person? If you look away, it might hurt less, and you won't even feel it. You're always going to feel it. They're just picking inside your vein right there. It's going to hurt. Even if you look away, you're still feeling it. Fear should be doing about looking. Fear is more about looking than just actually feeling it. Like there's no amount of bathing in the water that could actually stop that. You can't, unless you have an immunity to pain and you have high pain resilience and higher pain tolerance. And fair enough. But me, I look at it and I just get, I have panic attack literally, because it's going inside and it just feels, oh, it just hurts and everything. It just feels, I don't like it. It's the worst experience I've been at doctors. Like getting a regular like injection probably doesn't hurt as much, but when they draw, it's probably because they're drawing the blood out from the vein, makes it even worse. And then your arm feels all tired afterwards. It feels sore when they put the bandage around it. But see, all done. How about they draw more blood? I bet they probably do anyway. I bet that probably hurts them, but they don't want to say it. That's the worst part. That is one of the worst parts ever. And it was, especially when you know you're about to leave. I remember being at the old doctors, right, the old GP, and you had to go back to receptions, and they said, "Oh, you got to book another appointment. Here's another appointment here being booked, or wherever it is." I'm like thinking, okay, you could I know that told me they could told me that over the phone or sent a message. I mean, that's then again, I had a phone back then. It wasn't because I was a kid back then. I was way younger, so it was different back then. Now I just send you a text anyway. Yeah, that just found that they could just send like a call or something like that to a family member. That's what they could have done. And so just tell me, oh, my family member that was next to me took me to doctors then. They could have told them there. But yeah, I never really listen to doctors that much. Sometimes they're not always right in that one, but you still gotta go. There's some issues that can't be fixed at home. If it's something that can't be repaired, then yeah, you gotta see the doctor immediately. But if it's something that's minor, might as well just leave it. I mean, might as well just see what they have on offer, I guess. See what they prescribe. And especially those doctors, right, that, you know, and those doctors where they get a bit rude to you, they better come and sit down and say, so what's the problem? What's going on? There's some doctors, right? I don't think I've ever had the experience of a rude doctor before. Never. But there are some doctors that say, no, sit down, no. Take off. Now, I remember that time I was with my nan before she passed away. Rest in peace to her. Before she passed away, she was in this doctor's, she was in this room and she had to take out some sort of injection, right? And I remember this perfectly well. And the doctor that was there was rude. As a doctor, you should be more confident. You shouldn't like you're always about to give bad news every single time and every single day, every single minute and second. You should be able to just being happy with the patients and being all smiley, that way to comfort them. All he was doing was I say, oh, take a cough, take a cough, go on, take off. No, Peter, Peter. I'm thinking, calm it down. She's no woman, my goodness. Sorry, no, I didn't mean that, but you know what I mean. Um, but yeah, I should have said something, but then I was just like, sometimes it's best not to say anything because you don't want to cause a bit of a stir. I mean, he still did his job. It's not like he just told her to leave or anything. That's good at least, right there. And the toilets was only one toilet at the old GP I went to, but the GP I go to now, the doctors, it's got a pharmacy mixed with it. It's got like like multiple floors, which is better. The old doctors I went to was just like what I think was, excuse me, 2 floors. I only went upstairs once, I think, or was it twice? I heard that that's where they do the injections, but they did it in the corner of the room, corner of the corridor, I guess. Yeah. I only been up there one time. Let me tell you one thing. There's those doctors that don't understand a single thing you tell them. When you give out a certain word, they're like, me not understand. Sorry, I don't understand any of this. You're a doctor, right? You're a professional. You should be able to know every single word you've been taught. You should be able to remember it. Whatever words we're giving you, you should be able to figure out what we mean. It's not always up to us. It's up to you. You're the medical professional. You should be able to tell us what's going on. You should be able to tell us what these mean for us. The doctor just look at it and think, oh, I don't understand what you've got here. Maybe consult another doctor. You're a doctor yourself, aren't you? Unless you're an imposter and you just hit the other doctor at the toilet or something, because they have a toilet in like their rooms as well. Which is quite interesting if I remember correctly. Yeah. I think I what was I doing? Yeah, I think it was some sort of like because it was like a sample the doctor went. I just can't remember. Yeah, I just I they just don't understand it half the time. They really don't. I don't want those stereotypes. I know those people are gonna come up and be like, oh, well, most doctors are Indian, you see. No, enough with the stereotypes. I think the old GP I went to had majority of Indians. Maybe it's owned by an Indian person. I don't know, but I'm not going to stereotype it. But this people that just understand. I mean, and they had to have another doctor in to help them out, which is understandable. You got to help them out if that doctor is on lunch or they're on break. Fair enough. That's totally understandable. I just don't understand how these doctors can eat after looking at what they looked at. They could look at a boil on the part of your body looks disgusting. They could look at some sort of like something that just like some sort of pus that just like when you pick it, just like blood comes out. How can they eat food that they're eating and not think of that? They probably do. I don't know how, especially with surgeons, right? How they've evolved that is just totally beyond me. Um, I just don't understand it whatsoever in the slightest. I would be vomiting if I saw something like that. I would be worried, even if something smelled. Like, I think you have to have a strong mindset and a strong like stomach to be able to handle that as a doctor, even as a surgeon or nurse or whatever. It's just damn near crazy, you know. And yeah, there was that one time. Okay, I'm going to mention this one time too. This one time for me, it was quite weird. Basically, it was a time I had a really bad cough. Obviously, the coughs I used to have then, it took at least over a week or two to actually recover from. But when I last had a bad cough, which is recently, it only took out what 3 4 days until I healed. Not bad. Immune system's quite strong. So I went upstairs. It was on the top floor, which is I think first or second time I can't remember. And this guy, I'm not going to take the piss out too much, but when I went to see him, he's like, "Oh, so what's wrong with you then?" I just have a bit of a cough. Luckily, I don't know how I just managed to understand him. And he's like checking. He's like, "Oh, what's got you there?" Sorry. I mean, I was thinking it's a different language of it, but I'm not gonna judge too much and assume anything. But that's just the way he spoke, and I feel like no, this is not even being rude. This is actually part of facts right here. Employ people that actually can talk. That's not disrespecting. He could do any type of job, but to do when it comes to talking, not many patients are gonna understand him. I don't know how these people study to become doctors and they got it. They must have obviously done the written work well. you got to make sure you study and you got to do it's got to be about written work at the end of the day. More some practical as well, but then you got to think the written work also would help you get what you need. I mean, I don't know how it works in uni. You need university for that. That's one for sure. I don't know. Maybe it also depends on both, but I assume written work is also important in that too. I don't know how he writes too. I don't know what how other patients feel about that person. I mean, I know what's happening to him now, but yeah, this is why they should employ people that understand what they're doing. They shouldn't just employ people with degrees, man. They should employ people that understand what they're saying and that are intelligent and that understand. Not saying that those doctors definitely are intelligent. They got the degree, just they work there. You have to be really smart, knowing what you're saying. But at least employ people that are more clear in what they're saying. That should be the main thing in that one too. Um, and yeah, especially those doctors in hospitals. Like it's not. It's technically the same topic. It's saying I'm maybe moving on to the hospital part, but yeah, when me and my partner, the one I'm in a complicated relationship, I'd say partner anyway, and slash baby mum, we were at the hospital and the doctor's there. The service is good, right? But the amount of times, like this is the thing, like even mistakes that they made, and especially those doctors that that say, "Oh, this your baby's ready to go home now," but the baby's gonna stay for longer. That's what they did with my daughter, with me and my partner's daughter. They kept saying she's gonna be going home on this day, but she doesn't. You got to be more clear. You got to be clear on what you're doing, on what you're planning. Don't just be saying it's good. What if there's like a strong plan that was made? It could be any parent. What if there was like a strong plan that was put in place? Like, what if like the parents had a plan to take their baby or babies home on that particular day, but then they find that they have to do it another day? It's just a waste of time. You might as well just have a set plan. And then, well, but they'll turn around and say, well, the baby isn't quite there yet. Then you should have known that earlier, then, shouldn't you? Like, you're the doctor, you should be experts. Well, midwives. Doctors slash midwives, but yeah, I'm going to basically tie this under doctors, but these topics will come underneath that as well because it's hospital doctors. And the receptionist there too. It's just that, I mean, some receptionists are rude as well. The way they look at you. I had that one back at the hospital where she looked at me and she's like, oh, who are you? My name's Frankie. Frankie knows I'm the dad. Oh, what, huh? And she had to talk to another, and then she kind of told me to leave. Just burped again there. And then the nurse that saw us, I don't know if I think she's a midwife. I think most of them are the front midwives. But I'm going to say doctor and you just say nurse, doctor, whatever it is. She said, oh, why are you letting it, why are you leaving him out there for it? That's the dad. At least somebody acknowledged. Thank the Lord somebody acknowledged. I'm kind of happy and relieved about that, man. I really am that. I wasn't stuck out there. Man, I should have pressed the button, the button again. Just said, look, I come in, please, man, come on. Yeah, and especially those, midwives there as well. That there was one or two midwives there that wasn't necessarily. I'm not going to mention names, but it sounded like they had it in for, me and my baby mum. Like I'm not going to get into too much detail about it, but yeah, I do feel like they shouldn't be judging too quickly. Yeah, we have disabilities. That's fair enough. But I've seen people in wheelchairs that look after kids, and they're quite good at doing that. So what's it different with us? Like we can walk, we can talk, we can eat, we can do a lot of things. But I've seen parents there. I've seen like other parents there too. But there was like parents of like a few babies that didn't even turn up often. So they could have told them to get a balance, but because we had more free time on our hands, it was easier for them to call us. But we were more committed. We were more committed. We're just as committed as the parents that were also going there too. So yeah, and yeah, I'm not gonna mention too much about that, about parenting and stuff like that. That could be on another video I could talk about. Yeah, I think I've spoken about parenting on TikTok, but I could go in more detail about parenting on another video on this channel, possibly later on, I guess, when it comes down to it. I just want to talk about doctors and all that sort of thing. So yeah, what else? Oh yes, should I talk about dentists? I mean, they technically are part of that, I guess. Should I? You know what? I'm just gonna go in with the dentist part too, because they can't they kind of count as doctors because they're related to teeth and stuff like that. So yeah, dentist is not really much to say about that actually, apart from like the bit I hate when it comes to like when they when they have to remove a tooth. Oh my god, let me tell you, I can't stand that. There was a time where I had braces, and they had to remove 4 teeth, two on one day, two on another day. The injection, it felt like it was in a horror movie. My teeth were that strong, they had to yank out of a plier, really yank out. It didn't hurt, obviously, but you just feel the after effect of when the whole, like, anesthetic just wears off, like, you just feel that they're a bit of, like, you feel something missing here, and it just feels kind of like it hurts a little bit. I'd take a few days off school because it was hurting there. I couldn't cope with it. It was right there, was hurting me on this side as well. It just really got into the root on the nerve of my gums, It just really kind of hurt. And it wasn't that painful. It just felt a bit sore, you could say. But they had to do it to fit the braces in. Don't know if they had to do that, but that's what they suggested. The way they had to do the teeth was, they were there for quite a while. There's a time I had to go to the toilet, was asking that a while. So yeah, what was the experience at the dentist? Not exactly much. The time I had my braces off was on my birthday, so I'm happy with that. I was really happy with that. That was years and years ago. Yeah, donkeys years ago. I had them off. It's a relief to get them off because I didn't like them in my mouth. I hate wearing those rubber bands as well. For people that have had braces or have braces, they know what I'm talking about. You know what I'm talking about in that sense. And yet they always come. I always hate when these dentists always say, "Oh," even though for donkeys, I say, "Oh, brushing properly. Look, you're straight. Look, see there, back to you." Yeah, the reason why that is because of stuff I'm eating. It's so easy for them because they bleach their teeth, basically. Um, yeah. So to make it look like that, their teeth are extremely clean. Your teeth aren't maybe that perfectly clean. So when you keep brushing, it's kind of like, imagine when you're chipping wood off, right? Chipping off the to make the wood smoother, basically. Like getting all the chips of wood off. It's kind of like that. When you're brushing your teeth, you're actually scraping off the teeth and the gums because you're brushing there and you're just scraping it, and it's not a nice sound. When it's not good when they say that, because they're actually getting a bad example. I don't want my teeth to disintegrate. So that's why it's best to brush them at like a certain amount of time. At least being like there for like 5 minutes, possibly. I think I'm in there for a bit less. But look, that's how I feel anyway. That's I feel on them. There wasn't really much else to report in the dentist. I mean, they give you those fillings which I never seem to understand. um, yeah, I don't know, but yeah, look, I think that's it. There's not really much else to discuss basically. Could I talk more about the hospital? I could talk more about parenting and stuff like that. There's not really much else to report. I mean, I know I was at the, me and my baby mum were going to hospital frequently. I know she was staying there for a while. There's not really much else to report. I mean, the food wasn't too bad that she got. I mean, she got good food there. They looked after her well. I can't compare the hospital too much. I'm grateful for that. I just kind of wish the plans would have been a bit more clearer. I kind of wish they didn't get people involved as well. I don't know. I'm not going to mention too much on that one. But look, everything's all good. My daughter's fine as well. Everything's all good on that one. And then, yeah, not really much else to report. I mean, the oxygen made out of the hospital was good after all. It just got a bit hectic there. But I'll probably explain it in a different video anyway. I don't think I've explained it in another video. I'll see. I'll just check anyway. But yeah, I don't know what I'm going to title this video. Whether I title it, that will be the title. I'm probably going to have to mention like all the type of like health workers and stuff like that. You know what I mean. So yeah, that's it for this video. If you enjoyed the video, please give a like, comment, share what you know, subscribe and hit the notification below. So see you in my next video.